look cute to be at the doctor. You don't look sick, none at all.
I don't know who comes to the doctor dressed like how you're dressed in your belly skin and spike heels.
No. I said I'm going to wear things that I have not worn today. I have on a new panty, I have on a new blouse, and I have on a new pants and a new belt.
Why do you make it sound like I'm wearing things I have not worn in a long time?
No, I've never worn because I have things in my closet that I've never worn.
But I got this beautiful
You haven't
dress.
even said the welcome or where we are. People know we're not in the closet and you're just showing your dress. Wait! Oh, he frightened me. Oh.
It's so cute. Isn't that so cute?
That's very cute. That's very cute.
I love it.
It frightened me. Hello everybody and welcome to another episode of Tuesdays with Tricky, where we take your mind off of what's going on outside the closet, and we're outside the closet. I don't know if you've noticed, but we're outside the closet.
We're very outside the closet.
We're very outside the closet.
And I just want to say thank you to Closet Clutch for my super cute little dress. It's a skirt. Isn't that cute?
It's not skirt. It has a shorts underneath.
And this is like a crochet top.
It doesn't make it a skirt.
So it's like...
Well, I was already dressed in my shirt that I bought off of Amazon from like a year ago, and so I wanted to wear my things.
Okay.
I wanted to wear my things.
Okay, you don't get to modelly things though.
No. Okay, so let's explain where we are and why we're here because of she. So I'm just going to sit over there because honestly, today is not about me.
Wow, wow, you admitted it. How could you? You want to talk about it?
Because this is my closet. Okay. So Tracy's always has a runny nose, she has a leaky eye, she's always going right? So I realized that something she's doing that. Do you guys do that? Like, it's very disgusting. So I said, it's Tracy, it's disgusting and it's weird.
Is that why it took me so long to find a man?
Yes, because you're
nobody wanted to do it me.
So then we realized that Tracy may need to be tested for her, well, not her weirdness, but for her weird sounds. Well, you need to be tested for your weirdness too.
Well, that's two different doctors. But
anyway. And then we realized that there is a greater issue with like underlying allergies and our environment.
So the thing is that I have really bad allergies and I'm always constantly on Zyrtec. I'm on Zyrtec, Claritin, that doesn't work anymore for me, so then I have to go to citrine and that doesn't work anymore for me. I have to go all over the place, and it's just like sometimes I get these rashes and I can't control the rashes. I have to use what's that kind of cream?
Rash cream?
No, it's the cortisone.
We're being coached.
And then like, you know, it gets around my eyes and my eyes like, oh my gosh, the other day I thought I had pink eye. I was supposed to go to this party, but then I had scratched my eyes so much I thought I had pink eyes. So then I went to the eye doctor. Anyway, I have really bad allergies, so I decided.
And then the only reason why I felt sorry for her is because Remy seems to have allergies too. So I was like, okay Tracy, we'll help you out. So today
we are now with this special allergy doctor who has studied abroad, and actually there's no allergy doctor in Jamaica that has such a complete allergen test. So
ladies and gentlemen, please welcome
Dr. Kimmy.
Hi everyone.
She was speaking her intro. She has a very long intro for you. Would you like Dr. Kimmy to take over?
Yeah, Dr. Kimmy will take over.
I'm here with my two favorite patients in the whole wide world. Thanks for the introduction, girls. I'm Kim Cousins. I am the first board certified allergy immunology tending physician in Jamaica, and we're excited to try and bring my specialty from the US to our little island here. So as we said, Tricky here has terrible allergies, and today we are going to work to find out why she has all of these symptoms of itchy eyes, scratchy nose, the weird noise, move the weird noise. And also just to find a great way and solution of managing her allergic disease, and to discuss that with you guys today. So I'm so excited to show you what I do for a living, and we get to make it super fun, which who doesn't want to have fun with their doctor?
So, before we get started into the pricking and the prodding and the poking, I had initially wanted to go to the States because there was nobody who does testing out here, but then I got logged on to you that you do the testing out here, and then when I was speaking to you, you were saying to me why it's so important that I actually stay in Jamaica and do the allergen testing out here in Jamaica. So can you just say that for me in all of your terms, because I don't speak as well as you do.
She speaks fantastic. Don't even start. So one of the things that we try to say is that when you go to see an allergist in the US, you are being tested for the panel within the area. So I was really fortunate to do my training. I'm actually internal medicine boarded. Following that, I became dual certified in both pediatric and adult allergy medicine at Mount Sinai, New York, and I moved to be an assistant professor at UF. And so when we work in the US and our patients come from the islands to see us, we actually do the panels that are related to our local area. And so I'm so pleased to have been able to join up with some of the most amazing international allergy companies to have created a panel just for Jamaica. And so we actually have the first allergen panel for Jamaica.
And so what that really means is that there's specific things in the air of Jamaica that don't occur in like Miami, New York, or anywhere else.
Exactly.
They only occur in Jamaica. So if you go to test somewhere else, you're not going to get these specific allergy testing, so you might not even find out what exactly you're allergic to if you're living in Jamaica and get tested outside of Jamaica.
Yeah, I couldn't have said it any better. I have like the most amazing patients here.
So
I'm
today
just going to have a little drink.
What about mine?
Trey, you want a drink?
Yes.
Doc, we have one for you too.
Oh, I would love to have a drink, and so we're tricky here, but there are a few things that we have to kind of prepare for our allergy visit. So in order to see your allergist, you do have to avoid certain things coming to the allergist. Bar none, in order to do allergy testing, we actually have to have you avoid a certain list of medications, including cetirizine, such as Zyrtec, Claritin, some certain nasal sprays that are local antihistamines that help with allergies. And essentially what happens is some of these medications can actually make the testing a false negative, which means that it just affects the testing and doesn't give us the results that we're looking for. Another thing too is certain medications can cause you to have heightened reactions, and some also less reactions, and alcohol is one of those things. So Tricky can't have a drink today.
None for you, all for me.
So today Jodi will have both.
I'm going to enjoy. First up is the Tropic Groove. So if you're in the tropics and your groove isn't grooving, you can come and see Dr. Kimmy, because clearly you're allergic to something.
What's in Tropic Groove?
In Tropic Groove is Prosecco, white rum, watermelon,
That was for
mint,
me.
grapefruit, lime juice, and natural sweetener.
That one was for me.
That sounds delightful. So we're actually gonna kick things off and start Tracy's allergy test today, and you guys will see exactly what an allergy test looks like. And as we stated before, it's gonna be the panel that was built for Jamaica, which I think is just awesome. All right, so
to make our appointment, we would have made our appointment with you, and then you give us like a portal where we upload all information. So it's kind of like a link to your doctor or to your doctor's office to find out what you need to avoid, how you can make payments, all of the things that you sign off. Like, you know, when I put Botox in my face, I have to sign away my life. That. So we're able to link with you on that portal. So that's when you would have told us to stop taking the citrine, to stop taking alcohol and stuff. But before you start Tracy's allergy panel here, we had seen you about 2 weeks ago. What did we do at that time? Because we've tested before, and this is why I'm over here, because I'm not allergic to anything but Brockman. So what did we do with the first panel testing? And then we'll also, over on YouTube, guys, make sure you check out the YouTube channel when I upload it later, because you will see when Tracy and I woke up very early one Sunday morning, because we don't want any more and those. So talk about that test first before we transverse into what we're going to do here, all about Tracy.
So what Jodi's relating to is like one of the most important things that I've really brought to Jamaica is stylistically how I practice in the US. I'm bringing the same style here, and that's really important to me. You know, the same way and the same standards, we're bringing it here to Jamaica. So you reach out to the secretary, you sign on to our portal. We actually have an electronic medical record where you can directly contact me through the portal. It's amazing. It has its own app, and you have more accessibility to your doctor. And we're also kind of creating a system of patient privacy where the standards are to what we have in the US in, you know, keeping patient safety. So what Jodi was talking about is 2 weeks ago they slept it in the clinic at 8 a.m. Jodi wasn't happy about that on Sunday. But she toughed it out, and you know, we, had Traci especially avoid all of the medications. They came in and we did the testing. Jodi was not allergic to a single thing, which she told me she would not be. And Traci was allergic to the world in Jamaica. So you know what that means. Scott needs to pay for more trips abroad.
You need to vacation abroad.
Yes, I don't get that allergic reaction, you know? Yes.
So we're going to drop in some clips on YouTube of those tests and how that test was done, which I thought was very interesting. And then so because she was so allergic to so many things, is that why she's doing a follow-up now?
So we're actually going to demonstrate that test from 2 weeks ago.
Okay.
Just for everybody so that they can see what it looks like. That's
Okay.
a standard first level of testing. And actually Traci's here to do more advanced testing, which is what we call intradermal testing. So the first one are standard allergy skin test. And then the second one is going to be needles, which Jodi was like, absolutely not. But Traci's like, please me. And yeah, so it's going to be in 2 phases. And we're going to clean her skin, mark on her, do the test very quickly, and then we're going to talk about some current things, i.e. drinks and cookies.
Okay, go ahead, Jay. What's happening with you now?
Well,
So this is what the allergy tray looks like. And it actually has all of the allergens that we're going to test today. And luckily enough, we have a whole entire comprehensive panel of 50 allergens that are going to be in our environment that we can actually build for allergy shock therapy. And we'll talk about what allergy shock therapy is once we determine what Traci is allergic to, even though I kind of already have an idea. So Traci, I'm going to clean my hands, and then I'm going to clean you up, and then we're going to do the test.
Okay. I just want to show everybody once again my pretty dress.
Well, Traci,
I love it though.
It's the time.
I really
Where is the
love
dress
this.
from?
Closet clutch.
You just like that. You know
I just like this. I like
when
this.
girls are happy their outfits have pockets?
Yeah.
You're happy that it has a
shorts. It's so cute though.
So guys, over on the YouTube and down below on Instagram, we're going to put how you can get in touch to book your appointment, whether it's you or it is your child or any loved one that has allergies. See me down here. So you want to find out exactly what it is, because once you find out exactly what the problem is, then you'll be able to find a solution and have less breakouts, have less of that noise.
Yes, Fire White K. Dr. Kim is based here in Jamaica. She is here. She studied abroad and she brought all this first world technology out here in Jamaica. And so, I kind of wanted to, as we clean me up with the alcohol panel, since we have brought all of this first world stuff here to Jamaica, how is the pricing going to go? Is this first world pricing as well? Because I know...
Such a good question. So we are really, really blessed to be outside of the US. So we've been able to subsidize the testing to be 1/4 of what you would pay if you go to see me in the US, where I'm based now in Miami. Yeah, which I think is awesome.
Oh wow. And then you were saying something earlier about being associated with
LabCorp.
Yes.
So we'll talk about that.
Okay.
No, Drew Tricky is not pregnant. We are not at the doctor because I am pregnant.
We're not at the gynecologist.
This is the allergy doctor, Dr. Kim.
Where's your office located?
Oh, it's going to be 34th Lady Musgrave Road. It's close to the AC Hotel in Spick and Span. I feel everybody in Jamaica knows the
Spick and Span.
Okay, which is the actual...
Whatever, on a regular basis.
Okay.
Like, I just rotate them.
And what nasal sprays do you use?
I just started using nasal spray and I just started, and if you tell me one that I will get, it's the one that they give it out a lot here in Jamaica.
Avamace.
Avamace.
That's the right one. Use it every day?
No.
You don't use it consistently. Do you need to do nasal rinses?
Yes.
Okay.
I do my
And do you
nasal
think that there's like any subjective okay, which is the actual instructions I have too. So, Traci, I'm going to draw on you. That's okay?
Yes.
Alright, so now Traci's skin has been cleaned up, and we're going to just mark up a few things to kind of highlight where we're going to put the text, okay?
What does this have to, how do you mean you have to mark where you put in the test? I don't understand.
So I'm just kind of giving us a guideline as to where we're going to place the actual allergen.
Oh, so you can match up to say this was,
Exactly.
okay.
Yep. To see how much landscape we have on the arms here.
Yeah.
Oops, sorry. So these are skin markers. It comes off with alcohol, so you don't.
Those are the ones you get when you're doing your boobs.
That's exactly right.
Yeah.
I've had them before.
I know those markers as well.
I'm not the boob doctor, but you know, maybe.
But she just said she was based in Miami.
So she.
So I do come down once a month, and we do the full-blown clinic. Actually, amazing news is this Saturday we're having our allergy nurses come down to train our local nurse staff. Currently we do it once a month, and the allergy shot therapy, I've actually teamed up with Dr. Gabby Meeks, who is a spectacular doctor, and we're actually bringing the practice of allergy here full time. So you see me, we evaluate, and we'll talk more about how the continuity of care will look. But yeah, so I'm going to be here full time, and if you do want to see me as a side consult, there are ways to do that. Yeah, that's it.
So then maybe it's fair to say that you're based in Miami, but you're here very often to take your clients.
Exactly.
Okay.
Yeah.
Who was that being so?
All right, so
like
we're gonna start the testing now. Okay, so I'm gonna kind of maybe angle a bit here. It's a little bit wonky, but we'll make it work. You ready?
Yeah.
All right.
Yeah.
First one.
Okay.
How does it feel?
Oh, it's not bad. It's not bad. It feels okay. Not bad. Not
Does it
bad.
hurt?
It's a prick.
So Dr. Kimmy is holding a plastic utensil here, and it has about 10 prongs on it, and at the end of each skinny prong is a needle-like sharp thing, and there's a liquid on it.
So we can actually show them what it looks like.
So
here,
I have a zoom in. But yes.
Yeah, there we go. All right, so this is what a tester device looks like. This is actually the Comfort 10, and you can kind of see like the little needles here. It's very painless, very quick, very easy. And so Tracy's gonna kind of hang here, and she's gonna cook, like we like to say. So just rest your hands here. I'm gonna move this and provide you some space.
Okay.
Okay. Then we're gonna set a timer for 15 minutes, and in that time,
Can I eat cookies?
you can eat cookies.
Okay. So because I've been a good girl and I did all my pricking, I have some cookies here from Strictly Cookies.
You can't move.
I can't move. She has given us some cookies and cream geez, some
Are you
Oreo.
trying it?
Wow, this is intense. We have some new product right here from Strictly Cookies right now. I did not even check it before we came.
Okay.
This is some new stuff. Wow.
Oh, hold on, Trey. Maybe you should have brought like. Don't move. You should have brought like a bowl or something. How are we gonna do this?
It goes into the cups.
Oh my gosh.
It goes into the cups.
Okay.
This is nice.
Dr. Kimmy, I may need this chair, but I'm going to pass to you because you're going to have to taste it. Anything with no alcohol, I will let you taste because she's on the clock. Okay, so what do we start with first?
Okay, well open up that.
Stop
box.
moving.
I'm not moving.
Okay, so today's Strictly Cookies has given us a cookies and cream cup. This is Oreo chip cookies and vanilla infused milk. So this now.
Oh wow.
So here we go. So if you notice, inside this is like a cookie with a hole, and in the hole is chocolate, kind of like me, right? You know, and then you take your
Vanilla infused.
This is the best doctor's appointment. You know, drinking Lady B, about to have like, you know, some cookies. This is
Why
great.
don't you get Dr. Kimmy this Strictly Cookies jar to taste while we are drinking the cookies?
That looks really yummy. I don't think we should share.
Okay, so while we're doing this, Dr. Kimmy, I'm going to be nice. I'll share with you, Dr. Kimmy. So here's your Strictly Cookies jar, and the jar for you stop moving. This is a berry cookie jar. It's vanilla cookies, vanilla whipped cream, homemade strawberry jam, homemade blueberry jam, and cinnamon spiced strudel. Ooh.
I'm feeling itchy. Come
Yeah.
into the camera, Dr. Kimmy, and let you have your first bite.
Ooh.
I have to say this is my favorite patient encounter. I got a whole entire cookie jar here. I'm gonna taste it and amazing.
Is it?
Oh yeah.
Of course it is.
Are you
It's
jealous?
Strictly Cookies.
You want some?
No.
I'm not sure how. Okay, so I'm gonna drink the milk.
Let me taste the milk too.
No, you can't taste anything. You have to
I just
taste
can't.
milk.
I'm itchy. I'm not.
So we're
mixed
gonna
I'm
do like
itchy.
a little. I don't want to drink too much. I don't want to put too much. You stop moving. So then I'm like in the evening, like, oh, children, bedtime. I joke, my house at bedtime. I was like, get the hell to bed. So then I have my milk and my cookies here. She said pour the milk into. I did pour the milk into the cup.
Did you know?
Oh, that's really good.
Is it?
That is really good.
So you don't want to give me some?
You're supposed to get some. You have to stay still. Oh, you want to drink too? You drinking?
I have to say, Jodi is my favorite patient assistant here. Nobody will get this type of service in this office. So please don't set those expectations of cookies.
This is so good. You know what would be really good in here?
What?
Strictly cookies. An adult version with like
Rum cream?
Yes.
Rum
Look at
cream.
you with chocolate on your lips.
Okay.
That means you were enjoying the milk shooters.
This is such a nice idea, especially for like a baby shower. No, I'm okay because I have my braces in. Especially for like a baby shower when you're doing that game where you have to shut the milk down.
This is so nice. So this is vanilla infused milk out of my cookie cup.
That's nice.
Oh good. Really, really good.
Oh,
So you can't move.
But I'm itchy now. I'm itchy.
So as you can see, we're going to put in some pictures over on YouTube where Traci's skin is just lighting up where the dots have been made. Because where the skin has been pierced is
and then
she's allergic.
You put the allergens there, and then it means I'm allergic. But it's I'm very itchy right now. I'm not going to lie. This must be hard, Dr. Kim, when you're doing children, for them to sit still and to not itch their scratches. How do you do this? Do you strap them down?
We just work with the best that we can. You know, kids are kids. Sometimes we do have to hold them down. Moms get very involved in the process. We lie them down. So you can actually test different areas. You can test the back, and you can test the arms. So kids that are kind of squirmy, we do test their back because there's more landscape to test on.
Yeah.
And not all kids squirm around. Some are actually really good. You'll be really surprised.
Really?
Yeah.
You beat them.
Dr. Kim is in there beating them.
Beat them. Beat them on the show.
She is not. Dr. Jodi is in there beating the children.
I'll give them cookie cups and beat them. This is really good. I'm really enjoying it.
You are really enjoying that cookie cup. Do you want to give Dr. Kim a cookie cup? Or
Where you have a cookie cup? How was your cookie jar?
The cookie jar was
Come on.
spectacular. I'm gonna eat Traci's cookie jar here.
So you have to put a little
Cookie
milk
cup,
in.
sorry.
Strictly cookies. Good addition. This cookie cup thing is so good. I want to like almost save some so I can go home and find some kind of Baileys or some rum cream.
Kind of show
Or you
you guys.
can-
This is what the cookie cup looks like. Kids with milk allergies and adults, this is a no-no. I'm just take a sip.
Is it good?
Tracy, is anything burning?
Yeah, over on this side on panel 5, which is this top one, I'm feeling really uncomfortable there. I'm feeling pretty much an all over like itch.
Yeah.
But I would say panel 5 up at the top there, like I'm feeling really.
I'm gonna do an extra histamine prick here for you, okay?
Okay.
So I'm gonna talk about controls. I think that's a really good idea.
I'm uncomfortable.
Really? How uncomfortable?
On a scale of 1 to 10, I'd say a level 2. But I can feel the discomfort. You know?
So Strictly Cookie says she's gonna do an adult version. Do not send it to anybody else until they send it to me. This is really good.
We need to test it out.
Uh-huh.
And the cookie looks so soft.
The cookie is very. Oh, you have in your routine now.
Yeah.
It's soft. The chocolate inside, it's like a good coating. It's not like, oh, I wish there was more chocolate. It's a good. This is a really good idea. I love it.
Okay, Jodi, can we shift over from the doctor's chair to the patient side?
I'm taking my milk.
So one of the things we talk about with allergy testing is we actually do control tests. And control test tells us it's a good test. So there's 2 things we look at. We actually prick the patient with salt solution because it's impossible to be allergic to salt. And when that happens is if the test for salt is positive, it means we're overreading the test. It means that your skin is too sensitive to read those tests. The other thing we look at is the histamine. So histamine is the things that make us itchy, which would make sense, right? That's why Traci takes Claritin or Zyrtec, and that's an antihistamine. So it makes us anti-itch. So I'm gonna just do a fresh prick of a control so you guys can see what controls are. Although this panel does actually have a natural control in it.
So you're doing like an additional control.
one, yeah, because hers is not as.
You have chocolate on your mouth too.
I do?
No, you don't. I do.
Great, went on camera with chocolate.
No, where's the color?
Professional hair.
You guys have chocolate mouths.
We do.
That's okay.
Everybody here does.
It's called
I
a strictly cookies mouth.
thought my husband was going to come online today because I told him I was going to get juke up.
So you think he wants to come and see you getting juked up?
I think he would have wanted to come to be like, don't juke my baby.
Oh please, you forget juke up.
What do you mean?
Yeah, I forget juke up. That's how this goes. Jodi Flawless just joined. I'm loving that name, Jodi Flawless.
Oh, I thought you were bigging up yourself again.
PT by PT just joined. I have my appointment tomorrow.
With
That
who?
was online. PT by PT, Messiatica.
Oh.
Jenny J just joined. Oh, I'm going to finish this cookie thing. This is great. All right, so now Tracy's getting an extra joke. Must be Tuesday. Oh, this is great.
Okay.
So when somebody comes in to do their test, do they get results same day?
Oh yeah, same day
Yeah.
results. So I think I'm gonna move the cookies.
Yes.
What? Okay, fine. What? No, yeah, give it to me.
This is our answer.
We're gonna clean off the patient area. I don't make any promises for cookies in the patient area for the future.
Fine.
Ay, ay.
What is this?
And so we can actually start talking a little bit of Tracy's test here. One of the things that shows us that there is a positive test is there is redness with a wheal. And actually nowadays allergists look more at the wheals, which is a bump on the skin from where we prick, because historically the flare would actually eliminate people of color. So now we've really adapted and changed the way that we read our tests to be extremely inclusive, which I always think is very important to advocate. So I don't know if anyone can see what's going on. Can we zoom in? Can we move you here?
Yeah.
So actually, as everyone can see, covering her boobs, keeping it professional. Tracy's tests are actually positive. Do you see the bump that we were discussing? And this is the flare. So we call that the wheal and flare. And Tracy is very allergic.
So she's positive. So this is one of the very few times you come to the doctor's office and you hear you're positive and you don't cry.
That's true. And actually this shows us that we do get real-time results. So currently in Jamaica, most people who are doing testing is blood testing. And speaking of blood testing, I wanted to kind of introduce the fact that here at Jamaica Allergy and Asthma and Immunology Institute, we are the first LabCorp international rep. So we're actually providing what we call tier 1 pricing for allergy tests, which are actually clinically relevant to our country. And tier 1 means it's the cheapest out-of-pocket pricing. And that's just such an amazing
Repeat all
thing.
of that because that's fabulous.
So we're going to be able to do blood allergy testing that's actually more relevant to our environment. So what's currently available in the market is actually panels that were built for the US and not really for Jamaica. So here at JAI, we've teamed up with LabCorp to become the first international reps to offer this. And who knows, there's more to come because there's beyond what we can offer for
What
allergy
is something
testing.
that I could be allergic to in Jamaica that I would not be allergic to if I lived in Florida?
Yeah, so certain types of trees, for example,
Okay,
like the elder tree that we have in Florida and the Florida landscape, that's going to be on those panels. You're not allergic to those because you're not exposed. So in order to become allergic to something, you have to be exposed over time to the pollen. So
Right.
in Tracy's case, she breeds up the pollen in Jamaica for all these years. She's been a resident Jamaican for most of her life, and she becomes what we call sensitized to these pollens and then becomes allergic. So the immune system recognizes these allergens and then actually acts against the allergens to cause her the symptoms. So instead of protecting the body, we get all these weird symptoms, which is kind of what we call an immune dysfunction. Speaking of immune dysfunction, that's actually the other side of my career. So you remember in the beginning I said I'm a board certified allergy immunology attending. So on the I side, so we have the A side that we're talking today. The I side is immunology, which is we see patients with what we call low immune systems, meaning that you're prone to infections like chronic sinus infections, skin infections, GI infections, and they're very rare genetic diseases, so the vast majority, I think, of people seeing me here would be on the allergy side. But just so you know, patients that we see are, for example, people who are born with genetic diseases that don't have an immune system or a functioning immune system. And I always like to draw the contrast to the movie Bubble Boy.
I want to say something. So I was speaking to somebody the other day, and he had cancer, and so he no longer has an immune system. Would you be a doctor that he could come and visit, or is it just born immune system deficiency?
That's a really good question. So actually, she's killing it here. So, you know, there are certain types of chemotherapy that can cause secondary immune dysfunction, and actually one of them that we do see sometimes is patients with lymphoma. They'll get medications such as rituximab or Rituxan, and that actually kills the B cells, so you can no longer make antibodies. And you know, antibodies are what we use to fight infections. So yes, there are secondary causes of a low immune system that we do evaluate, and sometimes, for example, steroids. Patients who are on chronic prednisone may have that, and that's something that we do manage together. So great question.
So you do that? Okay. So
if you sneeze, come here.
So we're almost at time. So the first 15 minutes are coming up, and we will talk about what Traci's allergic to. I'm gonna throw it over to Jodi while we get ready to read.
Okay. So I'm wearing my own clothes.
Jodi has absolutely nothing to say.
I'm wearing my own clothes. I'm not allergic to anything, so I'm just here for the ride.
So how do you feel about your husband coming out with the new cricket song? I just want to say, Stevie, I played it for her. I'm here now.
Hi guys, I'm here in today's show. I'm here. Hi, I'm Jodi. It's usually in my closet, you know, but it's okay. I'm here today. I'm still here.
Oh, we're not in the closet. We kicked Jodi out.
you come out of my closet and you keep me, but that's okay. Back to you, Jodi, with the sports. And sports. Okay, so Dr. Kimmy is now reading. So when you come in and you know you want your relief from your allergies, you actually get reading in real time. So if it is that you need some form of medication, some form of prescription, Dr. Kimmy will be able to help you. Like, this is where the buck stops with the stunting and the grunting and the itching and all of that. So I'm actually considering to bring Remy in, not at 8 o'clock in the morning though, to find out what's going on with Remy, because she has asthma-like symptoms. So I know, especially in the preschools, you have a lot of young, in the schools in general, there's a lot of children, well, only children go to school, and they have all of these allergies, or they keep getting sick, and you have them on antibiotics for 3-4 times for the year, which is not good.
Why do you come into the frame all the time?
Because you're being cleaned up. I think it's important that people see that you're being clean, because it's hardly ever happens. Oh, jeez.
I'll clean my hands after. So why don't we bring you into the frame here, Tricky? So everybody can kind of see the first set of testing. So this is panel 1, 2, 3, 4, and then panel 5. And so we were talking about the controls. And so this is Traci's salt. So as you can see, it's completely negative. Okay, that tells me I'm not overreading the test. So we always have to do 2 controls. So this here, this bump is our histamine. It tells me that this is a good test, okay? So histamine is what makes us itchy scratchy. And as you can see, actually, the vast majority of Traci's tests, and this is an additional histamine here. So the vast majority of these, which I know for sure off the top of my head, are mostly the outdoors. There is a few that may or may not pop up. So we'll talk about increasing her testing and moving her to the next level of testing. Here, they're actually negative, but look at this. Very positive, and I'm almost certain that this is a dust mite, which I find a lot of Jamaicans suffer from dust mite allergy. Very anecdotally, which means I don't have any evidence or data, but very soon I hope to learn more about our environments. So this is a good positive test, and actually it has what we call pseudopods, which means she's extra allergic. So it's not a perfect wheel, it's actually potted out, and that tells us that she's super allergic. So let's read it together here, Traci. Oh Lord.
Guess who's not allergic? Guess who's not allergic? It's me! It's me! I am not allergic! I am not allergic! So if your child is on antibiotics for more than 3 times for the year, you need to come and check out Dr. Kimmy, because clearly there's something in the environment that your child is allergic to, and you need to find out what it is, because being on antibiotics so many times out of the year is not a good idea.
Okay.
My 2 cents. I'm going now. Bye.
Thank you for the plug there, Jodi. So, in Traci's initial test, she's actually allergic to cockroaches. Yes, we can be allergic to cockroach and dust mites, both dust mite pernicus and dust mite farinacea. So she's actually allergic to 2 different types of dust mites, and that's what probably causes a lot of Traci's symptoms. So when
she's lying down with them.
Exactly. So we're going to talk a little bit more about, you know, the allergens once we do the final round of testing, and what you can do to avoid them, and also what we can do to treat them. So we'll go through management once we finish testing. So Traci, I'm going to actually clean off up here, and then we're going to do another round of testing, which is intradermal testing. And what we will do, okay, is we will test for everything that did not pop up positive, because if I test you for the things you're already positive with, I can actually cause her to have a severe allergic reaction. So it's just going to be the things you didn't test for.
Okay.
And that brings me to the next spot. What we will do is a round of intradermal needles with a higher concentration of the allergen. So no other allergist in Jamaica does this, and this is something that we're bringing to Jamaica, which is pretty exciting.
You shooting all of that into her? Oh.
It's actually pretty simple and easy.
Ooh,
It's not
alright.
painful.
No, breathing. Wow.
All Jodi heard was needles, and she was like, absolutely not. So
Wow.
So I'm going to clean you off here, okay?
Okay.
And I can actually roll in Jodi to do some nursing support here, which would be awesome.
Well, I was going to just zoom in and see what's happening over here. But what would you like me to do? I will definitely inject her.
No injecting for you. You'll just hold the skin.
Hold the skin?
Yeah, I'll show you what to do. Okay.
I feel like I signed up for more than I knew.
I warned her.
She did. She said you said intradermal needles.
Alright, I'm just going to warm my hands.
Oh, that was cleaning my hands. So go clean your hands since you're going to be in my sterile field.
You
please.
can use that thing. I just... So by doing the intradermal needling, will it, so when you're giving me medicine now, will it be medicine that is more, from allergies, is it going to be more tailored to me?
Yes, exactly. So we're going to put you to a higher degree of testing to know what you're allergic to.
Wait, I have to just make YouTube see what is going on over here. See, you if you head on over to YouTube, you can get a zoom in of what's really going on here. This is a lot. How are you feeling?
Nervous.
Don't be nervous. You'll see it's really easy cheese. And actually for the mommies, we don't really push kids to the higher degree of testing with intradermal needles. We think it's very painful for kiddies, but for adults, no sweat. Traci's like, oh my god. So I'm gonna actually, I cleaned the area already, right?
Yes.
I'm gonna draw on you here.
Where's my boob marker?
That one's gonna put too much on the skin here.
You guys have such shiny hair from this angle.
Oh, thank you.
Yes. It's because my hair's dirty. I'm just kidding.
It's because my hair is clean.
I just washed my hair for a once a week wash.
I washed my hair this morning.
Oh, let me see if there's any questions. Any questions, guys? I'm sure you guys must have questions. I notice a lot of new people joining because we do have so many people in Jamaica that have allergies and they want some relief, but they're not sure where to go, what to do, or who to call. So we're going to have in the description box, we're going to have how you can reach out to Dr. Kimmy to get your relief from your sneezing, itching, watery eyes. Also, Dr. Kimmy can help you with, is she allergic to grasamites? Drew, it doesn't seem so because she was talking to her. It's just me and you allergic to the grasamites.
What is a grasamite?
I want to know too. What is that?
Oh.
I'll tell you after Dr. Kimmy. I was being very rude. Drinking liquor in the doctor's office is not really a good... Actually, no, that's not true. It's not as it's a bad idea.
Okay, So I'm going to show everyone what it looks like. So this is what we call the control. This is actually just salt solution that we inject under the skin, and it's actually literally just 1 cell deep. It's a really, really, really tiny needle. You need to focus here. Okay, and so since Jodi's filming and won't be our partial nurse here, Tricky, I'm just going to have you kind of taunt the skin and hide your skin fat for the camera.
The meat. We call it the meat. The meat.
The meat.
Slab out the meat.
Yeah, exactly. No, don't be so awkward. It's okay. It's okay. All right. So the first thing we're gonna do is I'm gonna actually just pull here. All right. And inject really. There we go. Wasn't so bad, right?
Not at all. Oh.
No, exactly.
Oh.
Really, really easy. Very
Yeah.
simple. It's not painful.
No. Not at all.
So do you have any needles with Botox in them? Since I haven't been getting anything today, maybe I could get in.
Shout out to Dr. Meeks, who's my partner.
That's true. Very true.
I actually have my appointment with her tomorrow.
Oh,
It's a needle week for me.
Yeah, that's okay. Well, the needles are pretty similar, sticking really quickly here, okay?
So each syringe has now, we're narrowing down what she's allergic to. So you have, what is it?
Yep.
7 things.
So in this case, remember we're going to be testing things that she tested negative to. So these are the more heightened allergens that we find in the Jamaican landscape.
Right.
Okay, and so essentially we're doing a higher level of testing. So a really good example here is this is mango tree blossom, which I find a lot of patients.
Oh
are
wow,
allergic
I
to.
would
Yeah.
have never thought that.
Yeah, it's
Mahu.
actually pretty allergenic, and how we really define what makes our trees allergenic, and as you know, we don't test everything in the on the planet, is really and truly not things that flower, because flowers are insect pollinated versus blossoms, which are wind pollinated. So in order to make something allergenic, it needs to blow hundreds of miles out to pollinate the female fruit, and so we breathe in these pollens because they're almost specially designed to travel far and wide. And you know, every Jamaican has a mango tree in their backyard, right?
Very true.
So, oops, sorry.
I have about 7.
I don't want to be allergic to mango blossom.
You wouldn't be able to come over.
I know.
Farmer Sean and his mango trees.
Or maybe I have to just come over and run the AC.
Alright, gonna stick here, alright?
Guys, do we have any comments or any questions for Dr. Kimmy? Does anybody have anything they'd like to ask? Not even where we are? Trey, let's talk about where we are again. Let's get your mind off of it. You're being juked. Tabo.
I don't even remember what the address here is.
34 Lady Musgrave Road.
We're at 34.
By Spick and Span.
Right, by Spick and Span, 34 Lady Musgrave Road. Right here, easy cheesy, not a far drive, close to the OAC Hotel.
Right, okay. So at 34 Lady Musgrave Road, where we are at. Dr. Kimmy,
Yes.
what's the name of your business?
Jamaica Allergy, Asthma and Immunology Institute, for short JAAI.
Oh, okay, thank you.
Yeah.
And here, Dr. Kimmy, who is very highly accredited, she tests for allergies. Tracy, don't look amused. I was trying to get you to talk so we could take your mind off of what's going on, but it looks like your mouth is like.
I don't want to be allergic to mango
Can we
blossom.
drink before testing?
No.
No.
You cannot drink. You cannot drink, and you
Just
cannot
like
take-
drinking for what, like 24 hours? Oh, that's a lot.
17.
Maybe about. What's the sweet number here?
What's the suite number? Oh. It's the same as Dr. Amarali's office. I don't know what number that is. It has a P on the door.
Yeah, say
Unit 4.
Unit 4.
Or maybe 6. Oh,
Walk into the P.
Walk into the
Walk into the P.
Sorry, I know.
Doctor she's concentrating. So we're intravenously, we are
I know, I'm
intravenously
sorry.
testing for a few specified Jamaican allergens.
Allergen.
Right?
Allergen.
We're testing for the allergens. I'm doing some zooming camera work here, guys. Please go and check out the YouTube. I am working so hard over here. My hand them a shake, the muscle them a give out, but I am zooming and I'm unzooming. No man, I'm doing a great job over here. Today Tracy is a lab rat. Well, Tracy is the one that has the most allergies. She's allergic to everything. So in trying to find out how we can give Tracy some relief, we found Dr. Kimmy, and we're like, you know, this is such a great idea just to show other people how they can get some help and they can get some relief, and to know that it's not necessarily a good idea to go to foreign and get tested, because we have different allergens here in Jamaica than you do in the United States, even in Florida, because although they have very similar weather, they have very different allergens. I'm doing a great, I'm talking, I'm zooming, I'm videoing. It's how much time you had joker though, Doc?
17.
17 joke?
It wasn't 17 jokes.
Must be a Friday.
Minus 3, minus 3.
Okay, 17 minus 3. 1.
14.
Alright, quick stick, okay?
Oh, somebody was asking what's the price? What's the pricing?
Okay. So we do for an environmental panel, it's going to be $11 per skin test, and the total panel is of 50, so that's $5.50. Intradermal needling, that's $13, but if you do a cost comparison as to what we charge in the US, it's actually range between $43 to $50 per skin test. So it's, it is a bit pricey on the scale here, but the reason being of the price is actually the allergens, and I'll show you how small the vials are and how much they kind of cost. But lucky for us in Jamaica, the allergy companies were nice enough to subsidize so that we can actually have affordable allergy care here.
You are getting juked out down, eh?
I'm sorry. You're doing a great job though.
But even though, it doesn't really matter what it costs, because you're the only one in Jamaica with this type of allergy testing. And then you know what I find is the same set of people will leave Traci to go foreign and cut them hair, and the hair don't look good. So when you go to America, because everything is so much better in America, in America they don't have the same things here. They don't have mango blossoms and such. So it doesn't really make sense that you go to Florida for $3,000 and $4,000 and etc. Right? Health insurance. So it's already being subsidized by a lab in the States. So there's a fridge here full of medicine here for you. Boy, that one hot.
Yep, sorry.
And then in Canada, if people have severe allergic reactions, they use an EpiPen. So let's talk about an EpiPen, because I want to show you something special.
What just happened?
No man, we're still on live. We're still on live. It's okay. So we have a generator here. So all of Dr. Kimmy's special medications that she brings down thanks to LabCorp are here in this very special fridge here. And I did ask this question. So this fridge is temperature gauged, and if there's a power cut for a long period of time, the fridge can keep all of the medication stabilized for an entire day.
You did a great job.
So that was just a power surge, probably because I'm such a hot girl. So we're going to just take some hot girl juice. Lady B Mixology, big up to the hot girl juice. Yeah. And the hot girl over here, she's leaking hot girl juice, aka blood. But okay. This is a special one.
Oh, actually, Jodi, you could actually show them what the extracts look like.
Okay.
So this is our actual extract here for all the allergens. On the left here is our environmentals. We have here our food allergy testing, and then of course our intradermal trays, and then our testos. These are specialized medications. It's something that we're doing now. It's called biologics. We're actually bringing.
You have any Ozempic in there?
I wish. I'll have
Alright guys, so you can head on over to YouTube, where I'm going to give you a full show of what is in the fridge. Dr. Kimmy has some medications here that, she's brought down thanks to LabCorp to help you get your... Okay, sorry, so some medications here to get you... Oh, sorry. Get you some relief. Why are you taking out your retainer?
I'm going to eat that cookie.
Oh.
So we set a timer for 15 minutes and Traci's gonna cook here. So let's kind of talk about what Remy is going through with asthma. There is something special we want to show. So as an allergy doctor, we not only see environmental allergies with itchy, scratchy noses and itchy eyes. We are the asthma specialist. And so if your child has asthma or you have asthma, we always do recommend to be under the management of an allergist. We also see atopic dermatitis, which is an allergic disease, and other skin diseases such as itching when nobody knows why we itch, and hives. That's a very common one that patients come to see me for, and that's when we talk about biologics, which are specialized medications that we use to actually help to treat hives. And that's something that's not been done in Jamaica before. Other things we treat, food allergy and drug allergy, and very soon there's going to be an amazing announcement about drug allergy and some grant work which we are going to be doing. But one of the most common things I see with patients here, as you know, Tracy's eating a cookie in the doctor's office, is actually
so good though. Cookie is so soft.
is penicillin allergy. And so I'm pretty sure everyone has an aunt or a mom or a brother or sister that does have penicillin allergy. We really do advocate for you to come and be evaluated for it, because it's actually associated with a higher risk of death, bad outcomes in the hospital, and of course, you know, all around just higher healthcare bills, because when you have to use the more expensive alternatives to penicillin, the bills do rack up, both inpatient as just, you know, when you see your doctor regularly. Also, if you get your penicillin allergy, you know, tested, your poor primary care will thank you for that.
So 2 questions that have come up. So somebody was saying, what if you're allergic to heat? What can be done? Is it possible to be allergic to heat? I mean, I find that everybody can get really hot, but you don't necessarily have an allergy to it.
That's a really good question. So allergies is really broad, complex term, right? When you really go down to the nitty-gritty of how to define an allergy, it's really an immune stimulation. So heat in itself is irritating to the body, and it can stimulate the immune system to maybe overproduce histamine, and then what happens is what appears to be an allergic reaction. Or some patients with eczema, for example, heat will just flare the eczema because it's a physical stimuli. But in the strictest definition of how we actually define an allergic reaction, you actually have to have a protein. So for example, the cat protein that I tested Tracy here with, right, which is starting to show positive too.
Yeah, no pets.
The cat has proteins, right? We're all built of proteins, and when we actually expose our immune system to these proteins, it creates this downstream effect and a reaction that we see that causes allergies. So you can actually have your allergic disease, such as hives, be flared by heat, but to define to saying I'm allergic to heat is not necessarily the right way. But you are right, like you can have your allergic disease flared by heat. So it's a good question.
Another one that I found very, very interesting. Runchy says, I've been told I'm allergic to contrast dye. Can anything be done? And contrast dyes, when you're doing certain tests, especially internally, they use this dye in your body to kind of find a vein or whatever. And it's a good thing she was told she was allergic to the dye before she did the test. How else, what can be done?
Yeah, such a good question. I see this all the time. I do recommend coming to see your allergist. So one of the things that we've learned and really advanced in the allergy space, which I hope to kind of bring more education to Jamaica, is that the concept of contrast allergy is very controversial. So what do I mean by that? Actually, certain types of medications, for example, contrast, stimulates our immune cells called mast cells. That's just a fancy term for the cell that releases, as we hear the cookie crunching in the back, it releases histamine, right? Do you remember when I tested Tracy for the histamine? So it's histamine that causes this reaction that shows this redness here, this wheal and flare. So certain medications, such as contrast, actually stimulates the cells inside the body to produce more histamine. So when we infuse a contrast for studies, patients break out into hives, or they feel flushed, and they feel like they're, you know, short of breath or wheezing. It's because some of the allergic contents in the cells are being dumped from this medication. So it kind of talks to the cells and tells the cells, hey, produce this thing that makes us itchy. So actually what we do is we actually create a personalized plan, and we call it the 1371 protocol for patients like that. So whenever they do need contrast studies, we actually send them with this plan to their radiologist, right, or to the radiology center, and they institute that. And it actually has to occur about 3 to 7 days before, so when the patients go in, they're properly pre-medicated. Now, if you've had a severe anaphylactic reaction to contrast, you still have to come and see me, because we talk about the risk and the pros and the cons. So just going in for contrast isn't just a going for contrast. We actually discuss whether or not the imaging with contrast, the risk of doing it outweighs the benefit of what you're gonna get. So if a patient has a disease that really, really requires imaging with contrast, we talk about an aggressive pre-medication protocol.
Right.
The testing has become kind of controversial. The answer is yes, we can test for contrast allergy, but it's one of those really weird ones where it actually stimulates the immune system, and there are other medications that do this, such as ibuprofen, NSAIDs, like Aleve or Advil as well as aspirin. So you'll see a lot of patients come in and say, hey, when I took aspirin I got hives. So now we're learning more about medications, and really the practice of allergy has moved leaps and bounds in the past 15 years.
I feel like just sitting here.
I'm smarter now.
I'm so much smarter.
I'm so much smarter now. Joe, look at the phone.
Oh.
I feel a lot smarter.
Okay, we can keep going. That's why we're watching on YouTube.
Okay, so we're gonna finish off the time here, but one thing we're gonna do is talk about what we would do for Remy, right?
The asthma.
Yeah, so
You want to switch this, Joe?
No, you stay right there.
She's gonna sit here in my chair and I'm gonna coach her. So today we're gonna talk about asthma care, and we really have moved leaps and bounds in how we manage asthma in the past 5 years. We've changed out our guidelines and really adapted how we see the patients with asthma. I hope to kind of bring this standard to Jamaica to show that, you know, there is really just a different approach to asthma. It's not just clinical, it's not just coming in and telling me how you're feeling. We added what we call objective science to it. So we brought spirometry testing and pheno testing, which is
No, this is Levi wanting to know when he's being picked up. Sorry guys. But it's okay, so talk to this camera because talk to this camera.
Perfect. So essentially, we no longer just go off of clinical symptoms, we add what we call objective data to it, and we do spirometry testing and pheno testing. And actually I'm the first to bring pheno testing to Jamaica, which is a way in how we look at asthma, where patients blow into these devices and we actually test markers, what we call biomarkers, to talk about their allergic disease and see how we're treating them. So when I diagnose with somebody with asthma, I start them on medication, and then
Keep talking to that camera. Levi needs to stop calling.
So I diagnose them with asthma, we start medication. We actually have a way of monitoring the patient, and that's with the asthma testing. So we're gonna have Jodi sort of demonstrate what it looks like, and Jodi's gonna take over my seat and I'm gonna coach her in the side here. Okay, you ready?
Okay.
I just want to say this berry cookie jar
is really good. You're being tested.
I'm being tested.
Okay, hi guys, I'm on camera and we're back.
Finally, you get to go on camera today.
Sorry guys, on IG, Levi has his iPad at school today for his information technology class, and he's calling, I guess, to find out when he's being picked up. So, but you guys can always catch the repeat in high definition over on our YouTube channel. And for this particular show, we actually have some B-roll that's going to be added in. And I took the camera and I was doing some zoom in so you'll be able to see better what was happening. And also too, I think this is a very informative show, especially today. So maybe if you have allergies or know someone that has allergies, just for you to like sit back at a time where it's more convenient to you to kind of just go through what we were talking about today, because a lot of information has been offloaded. All right, lady.
A lot. Okay, you ready? So we're gonna put the ankle, the wrist there, ankle, your foot. Okay, great. You're gonna hold here. Don't touch the screen.
Okay. Okay.
So we're gonna coach Jodi, right? And the first thing you want to do, Jodi, is you're gonna take a deep breath in and hold, and let it all out. Perfect. And so when I tell you, you're gonna take a deep breath in. You're gonna put your lips around the tube, and then you're gonna blow, 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 blow. No inhaling and blowing out, okay? Just one deep breath. So I actually have to set the device.
Okay.
So give me a second here. I'm gonna have to standardize it.
So this is like when you get caught drinking and driving, what you're going to do is you're going to quickly put a penny under your tongue and then do the breathalyzer.
Who told you that?
So Jodi, what you want to do is you want to blow the candle. So if you look to the screen here, just turn. Are you ready?
Yeah.
Deep breath in. And blow, 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 blow. Keep going, keep going, keep going, keep going, keep going, keep going.
I can't do anymore. I can't do anymore.
That's because you're not blowing, you're hooing. Maybe you should try just to go.
That was a really, Jodi's typically a good blower, but she did test great earlier, but this was a bad example.
Okay.
So we'll do one more.
So is it
Don't hoo, just
blow.
So hold on, my lips like this or like this?
No, lips all perfect.
Oh, all right.
All right. So when I tell you, you're gonna start. So now deep breath in, and then you're gonna blow, 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 blow. Keep going, keep going, keep going. You're looking at the candles here.
I couldn't go anymore. This is what am I blowing for? This is
well, stop.
Great job.
I used to smoke. You don't remember I used to smoke all those years? I can't blow that good anymore.
She's like, she's a good blower.
I'm a good blower. I can't.
After she got married.
I feel like I'm gonna pass out. So what's that gonna tell me?
Hop over here.
blow job.
Let me sit back in the doctor's.
Okay, yes.
It doesn't tell us how good you are at doing a blowjob. It actually for the science, for the sake of science.
For the sake of science.
So we actually do a prelim reading, and then we have our patients take a puff of Ventolin, okay, or albuterol, depends on where you are. I think it's Ventolin here. You do 2 puffs of the Ventolin, and then you have the patient hang out for a few minutes, and we repeat the testing. And so if there's an improvement in the lung function, it actually tells me a lot of information. It tells me that you do have active asthma, and it kind of gives us a guidance. So then we start the medication, and we actually continue to do spirometry testing to monitor. In addition to that, we do the FeNO, which is a nitric oxide testing, and that's a biomarker where you blow in and we test the nitric oxide in your system to see how bad your asthma is.
So this is a lot of information, and I'm not following it all, right? So Mickey, my friend Mickey, she has very bad asthma.
I hope you asked Mickey if you could talk about them.
Mickey love me. She talk about Mickey all the time. So Mickey has very bad asthma. So the other day she was saying, oh, she doesn't have any more of her inhalers left. So I was like, oh, okay, let's go to the doctor and just get an inhaler, right? But then I was saying to Mickey, like, maybe we should go to see like another doctor because she's been to one doctor. So I was like, you know, what inhaler should we use? So in doing this test, there's 3 inhalers that Mickey has. One is the orange, brown, blue.
Benzotype, Ventolin, Fixotide.
Wow. Yeah, so we've actually really changed our inhaler game, and some of the things that we're trying to incorporate is combination inhalers. So now we do dual combination, which is a steroid component, okay, as well as what we call a long-acting beta agonist, which is just a fancy term for Ventolin that works really, really long, okay? So it opens the airways, and we actually have an anti-inflammatory component. We do have triple level inhalers, which I brought. We actually had a really, really good donation of samples for these medications. They're available in the US. I haven't seen them locally here, but it's a more advanced way of treating asthma with inhalers. But one of the things I also want to show you guys that I'm bringing to our local market is actually the concept of managing asthma with biologics. So we do have a cohort of patients, okay, who are not managed well with their inhalers.
Right, because Mickey was saying that her doctor had said that she's going to have to take inhaler every morning, like her tea. She'd have to take once, and I'm like,
that's a really good. So for patients who have what we call mild intermittent asthma, I think a really good example is myself. So some things that flare my particular asthma are infections. So when I have an infection, I actually start pre-medicating with my dual inhaler. It's no longer an everyday cycle because my asthma is mild intermittent. So what we did was we did an amazing study which looked at patients who were not taking their inhaler every day as they should have, and they actually fared really well. So they did well. However, if your asthma is very uncontrolled, yes, you do have to do your asthma inhaler every day. If you are doing asthma inhalers every day, we move from dual, so we do it as a stepwise therapy. So we do go from dual therapy to triple therapy, and if you're failing dual and triple, we actually move you to what we call biologics. And what do we mean by failing? Meaning you're requiring prednisone at least 2 to 3 times per year to control your asthma. So these are biologic medications. This has been a real game changer for us in the US.
Is that something like looks like an inhaler?
It's an actual injection
that
people do.
Okay,
so it's an injection that we use, and it actually it saves patients from having to be on steroids and prednisone, because as you know, it has a lot of side effects. So now we've really become super advanced in asthma care, where we do what we call precision medicine. And so we target the portions of the immune system with these types of medications to actually calm the asthma down. But this is the last step, right? There are so many other steps. Number 1, see an allergist, make sure there's no allergic disease that's flaring, right? Number 2,
going back to the special fridge.
There we go. Let's stick these in here.
So, Doc, we do have a lot of information that's being given to us here today. Has Traci finished over here?
So she just finished.
Okay.
Time up. Perfect. So let's kind of read what's going on with Traci. So do you want to show everybody?
So the biometrics would basically take place of steroids.
Yeah, the biologics
Right.
is to save patients from taking steroids every day, but not the inhaled steroids, the oral steroids.
Okay.
So within the inhalers, there is a steroid component, but the steroid dosing is so low, it's almost negligible. When we studied it, actually didn't have any side effect profile. You'll see studies that show that kids may or may not have lost an inch off of their height, right? So that's pretty much it as a side effect.
That's exactly why I wasn't a model.
Yes, it was exactly why. So why don't we zoom in and take a look here? Do you want to come over?
And so somebody's asking here, Hot People is asking, is there an over-the-counter inhaler? And I dare to answer that. So there would be no over-the-counter inhaler because you would need an inhaler with steroids to be able to open the lungs. And if you're using an inhaler without a steroid, which would be something that's over-the-counter, then you wouldn't be able to get the steroid.
Yeah.
And the steroid is what opens up the lungs to help you to breathe.
So let me.
I've been learning something about here, you know.
So let me show this testing and then we'll answer that question, because actually that's a really good question and I think our followers here are really asking excellent questions. So as you can see, Traci's readings have been positive and we're going to go to the map to see what she is allergic to. But you can tell that there is a wheal here in the skin. Do you see the bumps? Look at this one here. It's huge. Come hang over here, Traci. Let's read from the key.
Thank you to Closet Clutch for my dress. I love it so much.
Okay. So and then I'm gonna answer the over-the-counter and here what we're doing as a society and why
So Dr. Kimmy is making her notes on the jukes in the skin. How allergic are you on a scale of 1 to 10? You are going to die.
Dr. Kimmy makes me feel smarter.
Yes, so your questions will be answered in full. Not just full, but full. And guys, it is it's a lot of information. However, I do suggest that you check out the repeats in high definition over on YouTube, just because I do think this is one of the extremely more informative shows. And there are so many people in Jamaica who do suffer from allergies, and you're kind of wondering what's going on here. Well,
I didn't know that allergies, seeing your allergist, Dr. Kim was saying earlier, she's like, you know, we are kind of the base and we give information to, like, we give them to the dermatologist, we give them to the GI tract people, we give to, you know, asthma people. So it's like, you know, allergies actually affect a lot of different areas of the body.
YYK, are you a new follower? I see you here today, very active. So what she injected under the skin was, it was different little injections just right under the skin of different allergens that Traci could be allergic to. So then it would come up on the skin in these wheals or in these bumps, and it will show like the level of allergicness. That's just the answer, Dr. Kimmy. That is the answer. Don't even bother with the long and the fullness. That is the answer.
I'm gonna advocate for allergens to now be called polygens. so let me answer the over-the-counter inhaler and why as a society we move away from that. So we don't advocate for patients to self-prescribe inhalers. The meaning is that you really want to have somebody seeing you to ensure that your asthma is well controlled. So if you're kind of choosing and picking an over-the-counter inhaler, which we are not advocating as an allergy society against having over-the-counter inhalers, it's because you really should have your doctor monitoring your asthma. So I think that's a really good question as to why we don't like when patients...
Who has asked the most good questions today? And I have been keeping a tab, so...
I think Jodi went to medical school, guys. She did a great job. I mean...
That's it. That's it.
So I'm going to put some cream on her skin because she's very itchy. As you can see, she's super red, super allergic. And then we're going to talk about what Traci is allergic to and what we can do for her. Okay, so I'm just going to clean my hands here and then put...
So in this visit, we have had allergy testing, then we've had super allergy testing, the polygenated testing, right? And we're also going to be getting our solutions, whether it be, I don't know what kind of solutions you get, but you're going to be getting your solutions. So the tests are read for you, broken down. So it's not like you're leaving here like a regular blood test where, oh, in 2 to 6 weeks we'll see you back and we'll tell you exactly what is going on here. All right, good to see you. We'll see you if you could just talk with the nurse outside and we can see you back in another 4 to 6.
Okay, so let's talk about what Traci is allergic to. And so, who wants to guess?
Cats, dust mites, cockroach,
Grass.
grass.
Damn, she did a great job.
Cats,
Why do you
right?
need me?
Dogs too? Or dogs and cats?
No, not dogs. Yeah, so she is allergic to cockroach, dust mite, cat, and grass, as well as birch, which is a type of tree.
Oh.
Okay, yeah. So the type of grass you're allergic to is Bahia and Bermuda. Okay, so there are two types of grasses here. Birch tree. Okay, and then German cockroach and two different types of dust mites. So let's kind of talk about what we do for avoidances for some of these things, and we'll talk about the medication component. So in terms of dust mite avoidances, the problem with dust mites is that, oh my God, we sleep in them. So they're in your bed. So one of the things we advocate for is for you to buy dust mite covers for your mattresses. It kind of alleviates all of the dust mite protein that you're sleeping. Remember, that's 8 hours of dust mite exposure. Carpets, you want to make sure you keep those clean. Vacuum, ensure you're vacuuming the place. Sometimes if you have a really bad allergy, you should mask up when you're kind of cleaning the place. And then of course, like if you have kids,
drapery and all that stuff
all
too.
of that. You know, Jamaican people
Yeah,
love their
drapes.
drapery. Yeah, drapes, that's where the dust mites love to live. Kids that have really bad dust mite allergy, you want to take the teddy bears and freeze them a couple times per month, and that actually kills the dust mites. And when you wash your sheets, you want, historically we used to say you have to wash your sheets in hot water, but actually nowadays we just think that the drowning of them, so wash your sheets once a week, and that does help with dust mite. We do recommend HEPA filters. That's better for animal-based protein, so that's actually a really good thing. But you know, I always tell patients, if I tell you to get rid of your pet, you'll probably get rid of me long before you get rid of the pet. So I try to mitigate patients in terms of avoidances. Don't put the pets in the bedroom. You want to get a HEPA filter because the cat protein is actually one of the worst proteins. It flies in the air like pollen. So the cat protein takes a really long time to leave the house. So you want to make sure you're actively vacuuming the place, having a HEPA filter, no pets in the bedroom if you
No
have
pets at all.
a cat or dog allergy. Right, and so that kind of, those are some of small things we can do. When it comes to pollen avoidances, that one's really tough. So I tell patients, look, it's really hard to avoid pollen, but some of the things you can mitigate is during springtime, which you know we don't have spring here, but during the time that when you see, you know, the trees are pollinating a lot, you can wear masks outside, which nowadays masks are not so favorable because now we don't have to
But
wear
health
them.
is.
Yeah. So you can mask outside when you come in, you strip the clothes at the front door, take the shoes off, leave the shoes at the front door, wash your hair on those bad pollen days. Maybe one day we'll start doing active pollen counting in Jamaica so we can have a better idea of the bad days. Okay. I mean, I think that's so hard, right? Who's gonna be stripping at the front door? And
Well, it depends on how bad your allergy is, because if it is at my child, because look at during COVID when we were, you know, so scared and unaware, we didn't want to get sick, we wiped down our groceries. There were people in New York, there were friends of mine who stripped at the door, who wore certain things. So you don't know, you know, there may be people who have, you know, really, really bad allergens and they're going to do these things, especially if your child
Well, you know,
has
it's funny because you said wash your hair, and it's so funny. I never thought about washing my hair, but I do know when I'm sick,
That's
I
it,
always
yeah.
wash my hair, and then I feel better. And it's just something that I thought was like, I didn't really think that the allergens were getting caught in my hair.
Especially pollens, it gets caught in the hair, and you know that's right close to your face, so you get exposed.
So Dr. Kimmy, it's a lot of information here to offload, and I keep saying, you know, not just for the views and the dollars and the subscribers, to watch back our high definition over on YouTube, but I think this kind of needs another visit, you know, so we can touch on a few things. But really quickly, before we go, can you please demonstrate to us how to properly use an EpiPen? Because if my goddaughter, who is allergic to shrimp, if I take her to dim sum and she eats the shrimp, I'm going to stab her in her bottom. And that's apparently not where you stab. So Tracy's been having the needles all day, so let's see a bottom.
Yeah. So
Oh, my bottom again now?
Yeah, your
it won't be
bottom.
on the bottom, don't worry.
Oh man.
Not to disappoint Jodi, but the last plug I'll talk about is that one of the unique things that we're offering here, other than just testing, is actually allergy shots, right? Which has never been done in Jamaica before. So we do have our regular medications that we treat, and I do have a special regimen and a way of doing the allergy regimen with the medications, but ultimately we are going to be doing allergy shots.
So do you have the allergy shot here now?
So it's amazing news is that the American companies are subsidizing and they're actually creating the specific prescription. So for example,
Jamaica, because it doesn't make sense we get an allergy shot from Florida because they don't have the allergens. What is it? Allergens.
Allergens.
That we have here. Oh, this is amazing.
So when I read Trici's test here, I actually do a special prescription just for her. So each allergy shot is written specifically for the patient. We build them up over time, and actually allergies are one of the few things in life that we can cure.
Right.
So that maybe we can definitely talk about that another time, because it is a lot of information.
So what we're going to do is when you have Trici's allergen shot in office, we're going to come in and we're going to discuss that, because I think that is amazing. We do have, you know, some people who are logging in and asking questions, and what you just said is allergens, aka allergens, they can be cured. That is absolutely amazing.
So
I just thought she was going to be like,
So patients like Traci, who's really just worn down with the medication, and they come and they say to us, listen, hey, this hasn't been working for me for a really long time. What we do is we do a concoction of what the patient is allergic to, and we inject it into them, and over time, over years, we build the patient to a point, and after a while, when they're exposed to what they're allergic to, they don't react the way they typically reacted, and it's just been a game changer. Shots have been around for 100 years, and I hope to bring that here. So I think this Jodi brought up a really good point. So I'm actually going to bring up two types of trainers. Okay, so we do have multiple types of EpiPen. EpiPen is actually the brand. It's an epinephrine auto-injector. And so as Jodi said,
the most common one in Jamaica is this one. I've never seen that. I thought you had a box of chalk.
Yeah.
Chocolates for me.
There's no chocolates in here. Or cookies. So one of the things is that Jodi brought up is in the case of a severe allergic reaction to food, especially shellfish, actually one of the most common allergies in Jamaica that I've seen so far. And we can talk about that another time. So let's say that the child or adult has been exposed to what they're allergic to, okay, and they're having a severe reaction. And what do we define as a severe reaction? The throat's closing, they're no longer able to breathe. Sometimes we have what we call cardiovascular collapse, which is just a fancy term to say, hey, the heart stopped working because you're having such a bad reaction. And that's when it's time to bring out the big guns. And the big guns are the epinephrine auto-injector. So the way I like to do it, so this is going to be the most common one that you see here, right? We like to keep things simple. I like to tell my parents and my patients, you know, blue to the sky, orange to the thigh. And it's never a stab like you see in the movies. Please, no stabbing in the heart. It's actually in the outer thigh area. So we're going to use Traci's lovely leg here. Please keep it.
And my thigh is big, so you can't miss it. You can't miss it.
Are you really going to stab her?
It's like there's no needle in there.
Oh, man.
Yeah, so we're going to say blue to the sky, orange to the thigh, okay? And then you're going to inject in the upper outer thigh area and hold for 3 seconds. So 1, 2, 3, and release. Okay, so that's the first one. Do you want to give it a try, Traci?
Yes.
Okay. Or do you want to give it a try, Jodi?
Yeah.
We'll let you do the OBQ one.
Okay, Kylie. If you have an allergic reaction, Kylie,
Blue to the sky,
You
orange
have
to
to
the
remove the
sky.
safety pin, remember? Blue to
sorry.
the sky, that's a safety pin.
Kylie, you're gonna die.
Just remove the safety pin and inject. Don't stop, just inject.
1, 2, 3.
Perfect.
You shall live today.
So the last one that we have here is pretty nifty. It's called the OBQ. This one is available in the baby dosing, right? So we have all ranges of dosing for very, very baby babies. Pediatric dosing and adult dosing. So the OBQ is the only one that does have babies that are less than 13 kilograms. So tiny, tiny babies dosing. So this one's actually pretty neat too, and I like it because parents love it. It's easy to fit.
Pocket,
you know, girls with their small dresses. So I always say, hey, this one's pretty convenient. And it actually talks to you. So in case of a severe allergic reaction, if you pass out because of the allergic reaction, somebody just pulls it open. Okay? And it talks you through. Okay? So we can hear. Yeah, so you actually remove the safety pin and then you just inject.
1.
And we're done. So you can actually give it a try to Trace. It's super easy. Here you go. So somebody's having a severe allergic reaction.
Contains no place blanket against outer thigh. 2, 1. Training.
Spectacular job.
That's how Teddy Ruxpin used to sound.
This trainer may be reused for training purposes.
And so usually these ones just are 1 dose, a single dose.
Gray allergens.
Yes, everything is a single dose. We always advocate for parents to walk with 2 EpiPens because if the reaction is severe, you can give a second dose of epinephrine. And the next thing is don't walk with a trainer because when things get really flustered, you know, you may accidentally take out the trainer and administer it to the child and you're not feeling the needle, so you don't know. Right? So sometimes for severe allergic reactions, sometimes for more mild reactions, we can actually try like a dose of an antihistamine like Benadryl or Allegra or Zyrtec. We try to say use the liquid-based ones. But for severe allergic reactions, when in doubt, always go for the epinephrine auto-injector. And we can always talk about this with more education at our visits. But lastly, if you do give an antihistamine with an allergic reaction, never sit there and just like leave your child there. You always have to monitor them for 2 hours. So this is a lot of information. I don't think the girls were prepared for all of this.
So in wrapping, Dr. Kimmy, let's just go through again how we can come and see you. That you have your platform, where you're located, and like do your intro all over again.
Yeah, awesome. Yeah, so we do come down on the second Saturday of every month. We run a full clinic with our nursing staff here. You can see us at 34 Lady Musgrave Road. You can email us at either contact at jaaiinstitute.com or you can get us at jaaiinstitute@gmail.com. Or you reach out to our secretary. Gosh, shamelessly don't remember my number.
We're gonna drop everything down in the description. Don't worry.
You can reach out to us. We do ask that, so one of the things we're trying to impress here is that we do have very generous time slots for our patients. We do 50 minutes per new and 25 minutes because one of the things I find is important is to have time to talk to your doctor. So because our time slots are limited and we do have a waiting list, we do ask everyone to make an earnest deposit just to make sure that, if you do come in, you're coming in for that appointment because we're not overbooking our clinics. We're actually taking the time to see our patients, do every test that really they need for that visit, right, and create a personalized plan.
Are you respecting the patient's time? My goodness, you must definitely be from foreign. All right, Dr. Kimmy, we want to thank you so much, everybody. We're going to drop in the description bar down below. We're going to drop the
camera now.
Yeah,
we're going to drop the information. No, I'm fine. This is my chair over here. We're going to drop in the description bar all the information you'll need to know. And we're going to be back with Dr. Kimmy when she has a special shot for Tricky to help her out because, allergy agony is no more here at Dr. Kimmy. Alright, everybody, I want to thank you so much for joining us and make sure you catch a repeat over on YouTube because it was a lot to unfold here today. But we thank you so much.
So many great questions that we got.
More my questions were the great ones. Thank you so much, everybody, and we will see you next week with Tricky, who hopefully by then she'll have a shot because can't deal with that anymore. Bye, everybody. Thank you so much.
Having us.
Bye, guys. I'll survive.